If as a small employer I couldn't afford health insurance for my employees prior to PPACA, how will this legislation enable me to access the tax credit now, especially in light of the economy?
So what I think it would do now is if that employer decided to go out and start providing health insurance for the employees, the tax credit basically helps offset the cost. So if they spend $200,000 on health insurance for their employees, then they would be eligible for up to a $70,000 tax credit these first few years. One thing about tax credits are at least federal credits, when you get credits, you then have to decrease deductions. So in my example there, the $200,000 that you spend on health insurance, if you get a $70,000 tax credit, then you can only deduct $130,000 of those premiums. So it's not truly $70,000. The net effect is not truly $70,000. It's really $70,000, probably less the tax rate. So it would be depends what tax bracket you're in. Call it $50,000.
Okay. Will employers be required to provide dependent coverage?
Under the statute in 2014, the employer is required to provide only employee coverage. Now, what happens is that when an employee goes to the insurance exchange, they look at household income. And a family of four that has household income of $88,000 or less, that's 4 times the federal poverty level, they would qualify for a subsidy when they go to the insurance exchange. The employer only has to provide the individual, but they may still qualify for the subsidy depending on their household income.
In 2012, are we required to provide the summary of benefits in multiple languages?
Good question.
That is a good question, and I do believe that there is language that does mandate multiple languages based on your population as an employer. So the predominant languages that exist within your population, you do have to make the summaries available in those respective languages.
And one thing that's funny about the statute, which is almost impossible to read, is that it requires summaries to be provided in easily understood English.
You think they applied that standard to the bill?
Yeah. Next question, and we give kind of an example here. How is unaffordability calculated on multiple options? For example, a company A covers employee options. An employee enrolls themselves and a dependent and pays for dependent coverage. Can that still be determined unaffordable even though the employer pays the full employee premium, resulting in additional penalty for the employer?
The issue of affordability is based on what percentage of income the premium runs, and if it is between 8 and 9.8% of their income, then that is the benchmark for determining unaffordability. So you'd have to have information about, what the employee makes, what their income is, and how much the premium is, and then do that calculation and see. But generally speaking, the employer is only required to provide that employee coverage. And if they choose to take a more expensive option like family coverage, then that's really their choice. But your obligation as an employer is to insure that employee.
So for the purposes of the calculation, you're probably just looking at, is the cost of the employee insurance, how does it compare to that percentage of income?
Right.
If an employee opts out because they're covered by a spouse's policy from another company, what do they have to show as proof? And can we assume there would be no penalty in that case?
I don't think there's anything that talks about a requirement of proof.
No.
There shouldn't be a penalty in that case because they're not uninsured. They're simply opting for their spouse's employer's plan. So I've not seen anything that it specifically addresses a mandate of proof. at this stage. Let's don't give them any ideas.
If a dependent is eligible to get insurance through their employer, must they join their employer plan?
As compared to staying on their parents' plan under their parents, am I reading that into the question?
Well, there's a
Adult child.
couple of ways you could look at that, because as a grandfathered plan, the dependents to 26 does apply. However, you can exercise until 2014 as a grandfathered plan the exemption if they're eligible for coverage under employer-sponsored plan. So I'm not sure if that's the angle that question is coming from. I don't think there's any mandate that you, as a dependent, that you have to enroll. So I'm not quite sure the perspective of the question. So if we didn't get that answered, we can try again if you want to speak up, whoever asked.
Okay. Will grandfather plans eventually go away? And do you recommend staying with a grandfathered plan?
Wow, good question. How many of you have never changed your health plan benefits? No hands go up. You know, it's a difficult question to answer because until the regulations are issued in terms of what the trigger is to cause you to lose the status, it's not a question that there's an answer to today. The reality is, what I hope doesn't happen is they issue a regulation that says a material change in your plan. What's material to me and you may be very different things. So hopefully there's some clarity issued. There will be something that will cause you to lose your grandfather status over time. We just don't know what it is today.